the state of Israel doesn't always follow the trends in other Western countries, and that's the unfortunate case, it appears, when it comes to the rising rate of cigarette consumption and nicotine vape use. Now, in recent months, 2 Israeli teenage boys were hospitalized with collapsed lungs caused by vaping or electronic cigarettes. One recovered. The other, a 16-year-old, died after becoming disconnected from his ECMO breathing machine. That's an incident under investigation in and of itself. But as a result, the government authorities and anti-smoking advocates have ramped up their efforts to warn children, teens, and their parents, of course, of the dangers of highly addictive vaping, which has grown in popularity in Israel in the last 5 years alone, even just in focus. We're joined in the studio now by Ira Tolchin, the health promoter for the Israel Cancer Association. So thanks for being with us. Look, we're talking about the health of our kids here, teenagers. You know, this affects really everyone. Like, first, on the rising use of these electronic, vape cigarettes, the fruity flavors, the highly concentrated nicotine that they deliver. Does this, angle of appeal to kids, in a way, make them more dangerous than other tobacco products we see in cigarettes, even, for example?
It's dangerous because it doesn't look so, it doesn't seem so, okay? Because these days, cigarettes, we know it's dangerous. Everyone knows that, even small kids, although they see them, they see grown-ups smoking, they know somehow.
Little kids know, yeah.
Yeah, maybe, but some kids, it's a common knowledge that cigarettes are dangerous, they're causing deaths. And in Israel alone, 8,000 people dying every year from the diseases caused by smoking. And e-cigarettes, they were brought to us, to this world, like by tobacco companies, as reduced damage, as a safe option, is it healthier? But we know today it's not true, okay? And these fruity flavors and sweet flavors and also bright colors and also being like disposable ones that you don't have to, to do anything to make them.
It's a big marketplace.
So who is the target there? Me, you, no. We do not start smoking suddenly. Right. It's those kids who are just, introducing to a nicotine, which is causing their brain, because our brain are developing until the age of 25. And if you bring nicotine to this brain, it's damaging. And you are not talking about the damage to the lungs and to other systems. It's just, a lot of damage. And we just saw the devastated results.
Yeah, the ability to become heavily addicted, I believe, is much easier in these young people, that their brains take to this faster. I mean, look, I want to talk about the anti-vaping ads that have come out. There's been sort of an ad campaign targeting teenagers, not to smoke. But on the other side, as you mentioned, these products, despite being meant for adults, seem to be heavily, advertised and marketed towards children at this point.
Yes.
Are they winning the battle, though?
It's very manipulative. It's very, a lot of money is there, because it's a huge and international industry. It's milliards of billions of dollars, and no one wants to lose it. So they are just, looking for the new population of the new generation of smokers, and that's how it goes every year. And we were also already seeing reducing of the numbers of smoking before coronavirus, and then the pandemic just, the children were sitting at home, all the dangerous behaviors just rise, and between them also the vaping. And we are saying to the parents, do not get, shanti banti. It's dangerous. It's not better than cigarettes, and just, check the pockets of your children, because you cannot smell it, you cannot know, but if your child is coating and also nauseous, it might be a sign that he's smoking.
Look, there have been some top-level down, a Likud lawmaker in the beginning of May submitted a bill that would, ban the sale, at least of flavored, e-cigarettes. I don't know where that's going to go in terms of legislation. Is that the path forward, though? Like we've seen in other countries, many across Europe, many states in the U.S. banning these things, either outright, making them illegal, or controlling, the way they're sold. Are we going to get to that point in Israel?
Listen, we want to work with the flavors and the colors and the disposable ones, because we think that if we are forbidding these ones, we are saving our children.
California's done that, for example. The state has gone after the flavors and exactly try to whittle back the
we have this law that was promoted by Boaz Bismuth, I think, and we are very behind this law. We think it should go through, and it should be promoted. And also also you can see, you can watch Australia that are forbidding selling e-cigarettes only with permission by by a doctor. But also, we are talking about also regular cigarettes are out there on the market. So it's also very, very bad for everyone. And also, almost every child that is trying e-cigarette is going afterwards to smoke the regular one because they're curious, and nicotine is very much addictive. So
cigarettes themselves. I mean, we know the vape pen danger, the vapor danger, that's on the rise. Cigarettes also, though, cigarette use also on the rise in Israel. I mean, so it's a combination of.
Listen, we saw since like 90s, we saw a reduction of smoking in Israel. It was about 40%, and like 2019, it was about 20% of Israelis in Jewish population. Arabic population, it's a bit different. It's another population. It's about also 40% of men smoking. We saw reducing, after coronavirus. It's like the boat is completely crazy. It's very hard to. But we hope that we'll come to our senses. That the government will make everything that needed, and also we know that the Ministry of Health is doing everything that needed. So we will reduce this pandemic also.
Ira Tolchin, thanks for being with us from the Israel Cancer Association, especially when it comes to the vapor and the effect on young people, teenagers. So concerning to us all. So thanks for being with us.
Thank you.
Stepping out for another break, though. Back with much more still here on Zoom In, so stay with us. We'll see you there.